Hi, I'm Dr. Stephen Ross, co-founder of Cygenex, and welcome to Unlocking the Power of Genetics with Pharmacogenomic Medicine. In this presentation, we'll discuss a relatively new field of medicine called pharmacogenomics or pharmacogenetics and how it's changing the healthcare landscape. We'll discuss what it is, how it's performed, and how it improves patient outcomes. We'll also discuss how pharmacogenomics decreases healthcare costs, saves lives, and prevents adverse drug reactions or events. We'll also review Cygenex's unique software and how it selects individuals who most benefit from testing. We'll talk about the economics of pharmacogenomic testing, including cost effectiveness and cost savings. And finally, how we approach our data security, patient safety, and privacy. I'm going to encourage you to stay until the end of the program, where I will present a case study that represents how pharmacogenomics has impacted the life of one individual and so many people around him. So let's take a step into the future of healthcare with pharmacogenomic testing and how it can unlock a world of tailored treatments, a healthier, more vibrant life, and more engaged employees. We'll begin our journey by defining several terms that I'll be using throughout this presentation to help you understand and simplify the process. Let's start with pharmacogenetics. Pharmacogenetics focuses on how a single genetic variation or change in a gene may affect drug metabolism, efficacy, and toxicity. Pharmacogenetics uses a patient's genetic information to inform the best choice and dose of medicine for that individual. Pharmacogenomics, conversely, considers all of the patient's genes and how they may influence their drug response. Pharmacogenomics is like pharmacogenetics, except it typically involves searching for variations or changes in multiple genes associated with variability in drug response instead of just one gene. Genetics refers to the study of genes and how certain traits or conditions, such as eye color, hair color, and height, are passed down from generation to generation. Genomics describes the study of all of the individual's genes, also known as the genome. Now, two terms you're going to hear a lot about when discussing pharmacogenomics is adverse drug event, or ADE, as well as adverse drug reaction, or ADR. An adverse drug event is an injury resulting from the use of a drug. Under this definition, the term adverse drug event includes harm caused by the drug and harm from the use of the drug, including dose reduction and discontinuation of the drug therapy. Adverse drug events may result from medication errors, but most do not. On the other hand, an adverse drug reaction is a response to a drug which is noxious or unintended and which occurs at doses commonly used for prevention, diagnosis, or therapy of a disease or modification of a physiologic function. So in summary, it should be noted that an adverse drug reaction is harm directly caused by a drug at a standard dose during everyday use. And with that, let's continue with our presentation. Pharmacogenomics, sometimes called pharmacogenetics or PGX, is an area of clinical medicine that determines how a person will respond to certain prescription medications based upon their genetic makeup. Pharmacogenomics helps individuals get the right medication at the right dosage the first time, but it should not be confused with genetic tests used to determine ancestry, nor does it predict the likelihood that someone may be susceptible to a particular disease. Research clearly demonstrates a direct correlation between genetics and how drugs will behave in an individual. 90% of the U.S. population carries at least one genetic variation or mutation affecting their response to drugs. Someone taking more than one drug along with genetic mutation can increase the possibility of an adverse drug event dramatically. Pharmacogenomic testing examines and reports these changes and ensures a safer and more effective treatment protocol. Pharmacogenomic testing is one of the most well-researched areas in clinical genetics today, and a significant part of the new precision medicine initiative established by the administration in 2016. Pharmacogenomic testing can affect many areas of health, including mental health, cardiovascular, pain, cancer, pediatrics, and so much more. Genetic testing might sound complex, but it's a simple, non-invasive procedure. We can unlock the secrets hidden within our DNA with just a cheek swab or a saliva sample. So how could pharmacogenomics affect how you and your employees respond to medications? First and foremost, by preventing adverse drug events. An adverse drug event, also known as an ADE, can lead to emergency room visits, unnecessary hospitalizations, physician office visits, toxic responses to medications, ineffective treatment, and ultimately an early death. The impact of adverse drug events is profound. Studies show that adverse drug events are responsible for approximately 1.3 million emergency room visits per year in the United States alone, with over 450,000 hospitalizations from adverse drug events costing over $28,000 per patient, leading to approximately 197,000 deaths per year, resulting in the fourth leading cause of death in the U.S. and sixth in the world, and costing over $528 billion per year in the U.S. for adults alone. The impact of pharmacogenomic testing was seen in this study from the University of Utah in 2015. This study resulted in a decreased hospitalization readmission by 39%, a reduction in emergency room visits by 79%, a decrease in mortality rate by 85%, and an increased savings of $4,382 per patient per year. In addition, the physicians who participated in the study considered the test extremely useful. These are the results of a retrospective study at a tertiary hospital evaluating adverse drug reactions, reported between 2011 and 2020. This study was published by the Frontiers in Pharmacology and demonstrated an increase in adverse drug reactions and greater awareness by pharmacists and physicians alike. In addition, a total of 53.97% of adverse drug reactions were identified and considered preventable. One final study from the Teachers Retirement System of Kentucky included 34,000 retired teachers who, for the majority, were taking multiple medications with several comorbidities. Following the pharmacogenomic testing and based on their genetics, it was found that there was a significant amount of misdirected funds. Specifically, $1.7 million was being spent on drugs that they should never have been taken in the first place based on their genetics because they could not metabolize them. As a result, their provider was cautioned to stop that medication immediately to prevent adverse drug events. Another $10 million was being spent on the wrong dosage. And being on the wrong dosage can also lead to adverse drug events, as they may not be receiving enough of that medication or, in some cases, too much. Finally, it was found that $5.8 million was being spent on drugs that were not as efficient in delivering their medications based on their genetics, and recommended an alternative medication that would be more efficient, safer, and effective. Imagine a healthcare approach tailored specifically to you and your employees, a departure from the one-size-fits-all and the trial and error method. That's what pharmacogenomic testing can do for you and your company. Finding the right medication can take months or even years without genetic information. However, if your doctor knows your genetic profile and what drugs work best for you based on your genetics, they can provide targeted medication just for you the first time. But now, with pharmacogenomic testing becoming more widely used, we can prescribe the right medication in the right dosage to the right person the first time. This not only maximizes the effectiveness of treatment, but also minimizes the risk of adverse drug events by eliminating the trial and error process of the past, which is especially important for patients with complex medical conditions. Pharmacogenomic testing is more than just personalized medicine. It's a transformative step towards a healthier workforce and a more productive company. By embracing pharmacogenomic testing, your company can enhance employee health and improve employee well-being. It means fewer adverse drug events by providing personalized medications, resulting in a significant reduction in healthcare cost. Personalized medicine, along with genetic testing, is reshaping our healthcare landscape as we know it today. So who is a candidate for pharmacogenomic testing, and how do we select those that would most benefit? Cygenex has developed a proprietary algorithm that identifies the top candidates most at risk for developing an adverse drug reaction or an adverse drug event. After receiving your claim file, we identify individuals currently employed by your company and eliminate recent employee departures. We then take into consideration several factors, including those taking at least one medication, medications that have known actionable gene-drug clinical practice guidelines, as noted in the CPIC guidelines, as well as individuals who have a listed diagnosis such as diabetes, cardiovascular disease, cancer, neurological diseases, pregnancy, etc. Once your claims data has been risk stratified, we then pull insights for your data and the risk stratification and the total number of employees that we believe will benefit from pharmacogenomic testing. We will also provide an estimated return on your investment, an estimated cost savings of the entire project, along with a timeline for our end-to-end solution. Some employers prefer to start with a pilot program first, while most prefer to save time and jump right into testing the entire cohort. Either way, you'll see great results. We suggest you speak with your Cygenex representative to discuss these options. So where do the cost savings come from? The goal is to reduce or eliminate adverse drug reactions and adverse drug events. This begins with an increased effectiveness of medications. Once an individual is prescribed the right medication and the right dosage based upon their genetics, the drug is now being appropriately metabolized and working as it was designed to. Or they may have been switched to an alternative medication, thereby eliminating ineffective medications and reducing and eliminating adverse drug events. It's been shown that prescribing a medication that works for the patient increases patient compliance and decreases hospitalizations, readmissions, and office visits. This groundbreaking field transforms how we approach treatment in the ever-evolving healthcare landscape. Pharmacogenomic testing holds profound clinical significance in several crucial areas. For example, pharmacogenomic testing guides the selection of chemotherapy drugs and targeted therapies based on the patient's genetic makeup, revolutionizing cancer treatment. There has also been significant research in mental health and psychotropic medications, which has become crucial in psychiatry, determining effectiveness and safety of the medications for mental health conditions, leading to improved outcomes and better management in less time. Pharmacogenomic testing has also demonstrated tremendous benefits in pediatric care, ensuring they receive appropriate medications and dosages tailored to their unique genetic makeup, especially in conditions like epilepsy, ADHD, autism, diabetes, and more. Pharmacoeconomics is the science of measuring costs and outcomes associated with pharmaceuticals in the healthcare delivery system. Pharmacogenomic testing has been proven to reduce healthcare costs by preventing these adverse reactions, optimizing treatments, and reducing emergency room visits, hospitalizations, and mortality rates, making healthcare more efficient and cost-effective. Next, by considering genetic factors, healthcare providers can prescribe precise and optimized medication dosages, enhancing treatment outcomes and minimizing side effects. Pharmacogenomics can also predict adverse drug reactions and events before they occur. This knowledge guides healthcare providers to choose safer treatments, reducing harmful and dangerous side effects. Pharmacogenomics is personalized medicine. By analyzing an individual's genetic makeup, the healthcare provider and our licensed genetic counselors can develop a medication strategy tailored to their unique genetic profile. This approach minimizes adverse drug reactions and adverse drug events, ensuring safe and effective treatments for their patients. Here at Cygenex, we adhere to all regulatory, HIPAA, and GINA guidelines, ensuring the quality, security, and reliability of our genetic test results and safeguarding patient well-being. Companies that prioritize health with pharmacogenomic testing offer safer, more effective, personalized treatment options and a promising solution, enabling a higher quality of care and better targeted therapies for chronic health conditions and the elimination of the trial and error approach to prescribing, thereby reducing the time to receive the correct medication and the right dosage the first time. And with enhanced care, there will be fewer employee sick days and disability claims, resulting in lower healthcare costs for the company and its employees, creating a thriving and engaging workforce. Understanding how greatly pharmacogenomic testing will impact the employee benefits landscape will take some time. However, there are a few things we know for sure. We know that there is a rise in employee health cost, increasing prevalence of chronic conditions, and continuing adverse drug interactions, which are a severe concern in the U.S. workforce. On the other hand, pharmacogenomics is a credible and proven solution to help alleviate and curtail these concerns. You'll prepare your organization for the future by proactively understanding how pharmacogenomic testing works. Cygenex has made this affordable for you and your company. Contact your Cygenex representative for more information. Hello again. Before we wrap up this presentation, I'd like to share with you a case study that has really had an impact on all of us. It's about an individual who, at the age of 56, had his first heart attack. His doctors prescribed various medications and treated him with multiple stents over the years. But unfortunately, he had another heart attack and eventually died at the age of 72 from heart failure. His son, who was only 26 years of age at the time of his father's first heart attack, wanted to make sure that he was not going to be following in his father's footsteps and end up with the same early demise. So he had several tests run on himself and found out that he was in fact on the same trajectory as his father's health, with elevated cholesterol levels and an increased risk of heart attack or stroke within the next 10 years. So then his doctor started him on various medications, but unfortunately he did not see any changes in his cholesterol levels, but rather he was experiencing severe adverse drug reactions with muscle aches and pains from the statin medications he was prescribed. This trial and error prescribing went on for literally decades until his doctor recommended a relatively new genetic test at the time called pharmacogenomics. When the test results came back, he found out that he was not metabolizing any of the medications that he'd been prescribed over the years. And in fact, based upon his genetic mutations, he never should have been prescribed them in the first place. As a result, his doctor prescribed a new drug based on his genetics. And after just 2 months, he reran his tests only to find a remarkable change in his cholesterol level. What he found was a great surprise to him and an even greater surprise to his doctor. His total cholesterol went from 285 to 138. His LDL, or bad cholesterol, dropped from 153 to 63, and his HDL, or good cholesterol, went up from 31 to 42. Not only that, but his risk of having a heart attack or stroke over the next 10 years dropped from 24.2% to just 7.1%. And what makes this case even more impactful to me is that this case is me. I am that patient, and that was my father. Needless to say, the results of my pharmacogenomic test and my new medication based on my genetics have not only made a big impact on my life, but a huge impact on my family's life, knowing that I've reduced my risk of having a heart attack or stroke, as well as an early death. But mine is not a unique story. Adverse drug reactions and adverse drug events are one of those health issues that we now know can be mitigated simply by providing pharmacogenomic testing for everyone, no matter if you're currently on one drug, multiple drugs, or anticipated being on any drugs in the future. Everyone can benefit from this test. So I encourage you to take the next step and add this benefit to your company. Help yourselves and your employees improve their health by making sure that they're taking the right drug in the right dosage the first time, thereby reducing or preventing adverse drug events, decreasing doctor's visits, hospitalizations, and reducing overall costs for your employees as well as for your company, all while improving health outcomes. For more information or to begin this program, speak to your Cygenex representative or give us a call. We're here to help you.